have very negative effects on a person's mental health, which is the point that I made to Dr. Barrett on January 27th during a phone conversation where I attempted but was unsuccessful at resolving this situation for my son. As a parent, it's our job to protect our children both physically and mentally, as well as ensuring that their rights are not taken away, and that's something I will do until my dying breath. Just to validate my statement that discrimination has negative effects on a person's mental health, I want to provide some research. This information is published by the UCLA and has data provided by Dr. Gilbert Gee, professor in FSPH's Department of Community Health Sciences, Dr. Vicki Mays, professor in the Department of Health Policy Management, and Dr. Susan Cochrane, professor of the Department of Epidemiology. Their research concludes that there's a direct correlation to mental health illness and discrimination. Dr. Mays states we now have decades of research showing that when people are chronically treated differently, unfairly, or badly, it can have effects ranging from low self-esteem to a higher risk for developing stress-related disorders, such as anxiety and depression. A study conducted by Dr. Gee showed that victims of discrimination were more vulnerable to developing clinically diagnosable mental disorders. The Office for Civil Rights is an agency that enforces federal civil rights laws. They state that these laws prohibit discrimination on the basis of race, color, and national origin, sex, disability, and on the basis of age. So not only is the rule that you have in place putting my child at risk for catastrophic mental health illness, you're also breaking the law. I demand that there is a resolution to this grave infringement on our children's rights immediately. Our children have a right to public education where they are not discriminated against. I would like to make myself very clear, if this is not resolved immediately, I will take any and all measures necessary to protect my son, not only my child, but all of our children. Thank you for your time and immediate attention to this matter.
Thank you. And as I said, the children have overwhelmingly been very good with handling this situation.
Honestly, my son has been very against the mask since day one. I have spent over $100 on finding a face covering that he's willing to wear.
Sure.
And I understand there's a lot of children that are 4 that don't comprehend this,
Right.
but he himself, I haven't been here. I haven't fought with you about the mask at all. But when my son comes home and tells me directly that he has a problem and feels that he's being discriminated against, it's my job as a mother to stand up for his rights.
Absolutely. Thank you.
Thank you.
Okay. I'm sorry, now usually we save during the work session the public comment until after we have our discussion here. So I'm sorry, I kind of let that get off topic. Now, if we can continue our conversation, then we'll move on to the voting meeting. We will give you a little more time before that if anybody has anything else to say.
Okay, the last piece that we'd like to discuss at this point would be currently the CDC recommendations for quarantine are 5 days for anybody who's a close contact who is positive or is positive with COVID. I know, from day one, our biggest concern is keeping kids in school as much as possible. We've done that very effectively throughout the course of the past 2 years, especially last year and a half. We were one of only a few districts in the area and even across the state that opened our doors for students. But we continuously look at our data. We look at we speak with our local health officials. We look at data coming out from the state level as well. But looking at data, there are some other districts that we communicate with that are moving in different directions. There are 20 districts in NEIU 19, and many of them are going in 20 different directions. Well, many of them are probably going in 20 different directions. So, again, we're caught in the middle of all of this, and it's not an easy decision, but we're looking at the quarantine requirements for asymptomatic students. And we believe at this point it's necessary to quarantine those students and keep them out of school longer than necessary if they're not demonstrating symptoms. The other side of that would be if the student is symptomatic, they would stay home, they would have to quarantine. And if they're positive, they would obviously have to quarantine. And we're still following the CDC guidelines. The only difference in that would be asymptomatic students or close contacts may not have to quarantine unless they do become symptomatic. So that point would be the other part of the health and safety plan for discussion. Anybody have any comments or concerns about that?
You mean that it was close contact positively to stay in school.
If they're not demonstrating any symptoms, or that they don't have a positive test, and they would stay in school.
And I make it clear to everybody that both from the start, we're trying to do our best to keep everybody healthy, everybody in school, including our staff and all the rest of everybody, the teachers, the administrative staff, students. So that's what the end, so this kind of leads to that, where if we reduce or take away that quarantine period, it may help keep some people in. It's going to kind of be, I think, to some degree, an experiment to see how that works. And if we start getting large numbers, then we may have to rethink that.
And, we would keep the other components of the health and safety plan in place with the number of cases, percentage of the population within the building. If it gets to a certain point, we put masks on, et cetera. Or we can, we could revert back to the quarantine situation as well if necessary. But again, this is just for consideration, looking at some of the trends going on around us and throughout the state. So, currently, that we do quarantine asymptomatic students out of caution. That's what we've been doing from day one. Initially, it was 10 days, 14 days. Then it was 10, then it was 5. Now with the trends of the cases going down, we're looking at, again, more and more data, seeing what's happening in our buildings. So that's the last piece that we're looking at.
So if there's no symptoms, they can stay in school.
Correct.
Everybody hear that? If there's no, at that point, if we opt to do that, at that point, anyone, if they're asymptomatic, would not have to quarantine.
So how does that work if a student goes to school and then they're not sick, and then they are sick, somebody's calling the parents to come get them?
We would still contact trace, so we would notify the parents that they were close contacts still. So we have to still do that work. We would still report positive cases to the state. Again, the only difference would be that if you're not demonstrating those symptoms, that you may not have to quarantine, unless at some point.
Should I have a little clarification? Are we talking about close contacts who are asymptomatic wouldn't be prohibited, but if you test positive, you still would be
Yes.
quarantined?
Yeah.
Okay,
Yes.
I just want to make sure that.
And even if you're not positive, but you have symptoms, we would contact the parents and the student home required to quarantine.
So would you be testing the kids at school then?
No.
That was exactly one of my questions was, are you guys going to be performing any COVID testing at school?
No, we looked into the program. There's a voluntary program available. The student wouldn't be required. It would be parent choice to have the student testing in school. There's still a lot of logistical concerns with that. So I would not be ready to recommend it at this point.
So a question, if a student goes home with a fever because they're sick and the parent doesn't get them tested, do you assume it's COVID?
We would assume, yes, and they'd be required to stay home for 5 days.
Wouldn't you keep your kid home if he had a fever though, the next day?
That's exactly.
What's that?
Wouldn't you keep your student home the next day?
Well, I'm saying if you got a fever
Well, hold
in
on.
school,
Answer my-
absolutely.
Right, that's
Absolutely.
all.
But that also inflates the numbers and then it makes more close
Well,
contacts.
that's, I don't
If you're
think,
assuming
the
it's
numbers
COVID.
isn't a concern of mine, or I think anybody here. That's not the point. The point is if your student's sick, you're gonna keep them home, right? Right?
Well, yeah, but it's going to inflate the numbers.
Okay, all
What
right.
numbers are you talking about?
COVID.
Well, no,
Not-
they have to actually.
They don't get
test
tested, we don't know if they're positive. So
Like
we
I
don't-
said,
we don't
Well, that's
have
what I just asked. You said I would assume it was a positive COVID case. That's what you
Okay.
just said to me.
We don't know, so we're erring on the side of caution. We're not labeling them as COVID positive. There's a difference.
I guess the answer there, as it has been from the beginning, is if you feel ill, stay home.
That's all I'm asking is if you don't know, are you labeling that as a COVID case?
We will, but it wouldn't go beyond the district.
We would require the quarantine, but we don't count that as a positive case,
Okay, thank you.
unless we get notification that they're positive.
Understand, thank you.
All right, so the template I think that we're looking at to follow the most here, I'm going to read just very briefly here, mask and face coverings. Masking of all individuals Unvaccinated and vaccinated will be optional at all community transmission levels. Students and staff are encouraged but not required to wear masks while inside or outside of the school building. And as I'm understanding that, if everybody's in agreement, that would be district-wide. That's not just, that's not 4, 5, 6, 16-year-olds. That's the whole district. As per CDC's mandate of January 21st, 2021, all individuals, regardless of vaccination status, are required to wear a mask while being transported on district-sponsored transportation. This mandate is set to expire on March 18th of 2022. Funding, I think, on all the busing, we use the federal formula, right? Sorry, state. So this is one that we kind of have to follow, the busing mandate until March 18th is still in effect. So at this point, masks for the individuals on the buses would still have to be, until that, at least that date, would still be in effect. It's on the long side, a little over an hour each way. I think most people can handle it, especially when it's cold. Think of it as a start. The third thing is temporary tiered mitigation measures will be considered and may temporarily be implemented in school settings, such as masking or school class or classroom closure when in school case counts reach a 5% threshold. We already had the 5% threshold in effect, I believe, according to our current health and safety plan. So if the numbers start to spike, it gives Dr. Barrett the ability to say, okay, this building, this classroom, whatever has to do what they have to do to try to keep the rest of the building or the rest of the district, the rest of the students, faculty, whatever. So that's the first portion of it. And then the second portion was the contact tracing that Dr. Barrett just discussed. So I think this is kind of a good in-between where it covers with school buses and it gives us, gets rid of the mask mandate a little bit ahead of what some of the government agencies are telling us. If everybody's okay with that, it is something that we can add as an agenda item, but we need to, first we have to